Welcome to the Checkup. I'm Erica Teichert, Managing Editor of Modern Healthcare. While clinicians and frontline staff have primarily worked in person throughout the pandemic, providers and other healthcare industry members have often transitioned some staff to remote positions. Now, nearly 2 years into the pandemic, many employees want to maintain some level of remote flexibility. Finding the right approach for leadership and the workforce can be tricky. Children's Mercy Kansas City found a path that took employee and patient needs into consideration as it developed a hybrid approach to work. Here to discuss that policy is the Pediatric Hospital's CEO and President, Paul Kempinski. Welcome to the Checkup, Paul.
Thank you, Eric. It's good to be here.
So at what point did the hospital transition some staff to remote, and what positions are they in?
So, Erica, this whole transition to a remote workforce was really catalyzed by COVID. I think what we can acknowledge is that many other industries outside of healthcare had much more mature experience with employees working remotely and from home. But for us, when COVID hit and we realized we had to promote social distancing and the safety of our patients and staff, we immediately sent home nearly 25% of our 8,500 employee workforce into a home environment. And then we realized that we had an opportunity to look at the workforce of the future. And one of the few good things resulting from COVID is the fact that we realized that we had an opportunity to increase the flexibility, the productivity, and the general engagement of our workforce by enabling a remote work policy and program and model that had not existed in our organization previously, and to get to work on that in a much more intentional way, and one that would serve us well beyond COVID. So who it's impacted is really all of those non-direct patient-facing employees. Although when you really peel the onion on who that is, the conventional wisdom might suggest it's our clinical workforce, our physicians, nurses, respiratory therapists, and so forth. But there are many more individuals that we've realized along the way that may not be routinely and patient-facing on a daily basis, but do have the need to be visible and present in the workplace at times. And that helped to inform some of our policies going forward.
And who are some of those people who you've found did need to be in person that you may not have thought of originally?
Yeah, I'll give you a perfect example that's been on my mind actually today. So, we have a lot of emphasis on process and system improvement through the application of lean methodologies in our organization. And some of our process improvement specialists, when COVID hit, began to work remotely from their home. But we quickly realized that in order for them to be fully effective in their jobs, they need to do process observations. And that means being on patient care units in clinics and in other hospital-based and clinic-based operations where they're watching the work being done so that they can in turn facilitate improvements to the systems and processes that are taking place in those environments.
You mentioned that you've seen more productivity from remote workers. Do you have any data on that, or can you tell me a bit about how that's changed the mentality in the C-suite towards remote work?
Yeah, it's a great question. I think it's a little premature to actually see if we have data that illustrates improvements in productivity and engagement. But we're going through a three-phase process. Phase one really began as COVID hit, and we realized that there was an immediate need to send a number of employees home. And then we began to work intentionally and strategically on creating a model and a set of policies, procedures, and guidelines that would help to inform which employees can work from home on a relatively permanent basis, which employees really need to be in our facilities in some Children's Mercy workplace, and then what employees could be in sort of a hybrid model where they came into a work site on occasion, but also were able to work from home on occasion. And the work that we've been doing now is sort of what we call the beta testing option, where we have modeled some futuristic, more contemporary workspaces that are hybrid in nature, that bring employees together from different departments who can work in collaboration spaces and really test the need as to whether or not certain employees need private offices, collaborative spaces, check-in locations, drop-in locations, and so forth. And then in early 22, we'll begin the next phase of this experiment, which will be to test, collect data, collect feedback from those that are experiencing these new work environments, and then modify and refine our approach going forward. But our hypothesis is that we will have greater levels of employee satisfaction, greater levels of morale, greater levels of engagement, and we hope that productivity we will be able to both measure and see improvements, and also just retention and recruitment of the workforce during a period where we are facing those workforce shortages and challenges that so many sectors of the economy are facing.
So you mentioned the beta testing that's starting in early 22, correct?
The beta testing has begun already, actually. So, as a matter of fact, I was just meeting with my chief compliance officer today, and her team began to experience this week. They were in some of these pre-designed workspaces, spent a week working in them, and are now giving feedback to those folks who are facilitating these efforts on how it went in the collaboration space, what new learnings there may have been, what guidance they can give our steering teams and our process facilitators to refine our remote work model going forward. So it's actually quite exciting. The feedback has been incredibly positive, and the opportunity to engage our frontline employees as well as our management team in the process has really been invigorating.
To go to another side of that, thinking about the cost, both of remote work and thinking of these new hybrid and other measures, how has Children's Mercy Kansas City dealt with that?
Well, I think there's two perspectives on this. First of all, the opportunity to have more employees working remotely from home represents a potential cost reduction opportunity. We believe we have about 100,000 square feet of vacant space that may not be needed as this model matures and becomes systematized. So that has potential implications to our real estate costs and those lease arrangements that we have going on right now. And actually, the cost of implementation is very, very low to almost non-existent. We want to make sure that our employees working from home have a basic level of infrastructure, part of which we will support, part of which is the employee's responsibility. But the real opportunity, I think, is to use our limited resources much more efficiently, cost effectively, and have it really tie into the value and affordability that we want to create for the patients and the families that we serve.
So that extra space that you mentioned, is that within the hospitals themselves, or is that other real estate that you're leasing?
It's really a combination, but much of it rests in spaces outside of our hospitals and clinics that we currently lease, or in some case, remote buildings that we own that are only being partially utilized right now. So once the dust settles on these first phases of the experiment, if you will, we will have a real estate plan that guides us going forward to see where we can perhaps reconfigure our spaces, reduce our real estate footprint, and save costs going forward while we increase morale and engagement on the part of our employees.
And it sounds like there probably isn't a time where Children's Mercy staff will be 100% in person in the future.
I honestly think that those days are gone, to be very honest with you. Now, what I would predict, and this is just Paul speaking intuitively without data, I do think there will be additional learnings over the next 1 to 2 years as we test the impact on the remote work model against our desire to create and foster a culture of engagement. There will be some realities that will face us, and we will be guided by the experience of our employees who are working from home and in these hybrid models. And I think they will tell us whether it's a sustainable model for employees who are working in an industry, being healthcare, that is very much a relationship driven industry. So I think there will be some circling back toward the more traditional workplace models, but I think we will have, for the long-term future that we can predict, a significant portion of our workforce working from home or in these hybrid spaces where they come in a portion of the time and they're working from home a portion of the time.
How do you feel like that's affected morale, both with maybe frontline workers or with those who are remote?
I think right now it's really it's rejuvenated morale. I think coming out of the fog of COVID, which we hope we are coming out of, I think it's been a morale booster. In fact, some of the satisfaction surveys that we've done with our employees 97% of the employees who are working in these remote work environments at home have expressed an extremely high level of satisfaction with that opportunity, which gives them greater flexibility, nimbleness. Childcare has been an incredible challenge for our employees, as well as just about everybody in the United States who has children, to be able to ensure that they're getting educated through in-person school or teaching from home, and just access to childcare has been a struggle. So this gives employees more flexibility to ensure that their families are being cared for, which in turn helps them to be more engaged and more satisfied in the work environment, even when it's virtual. So far it's instilled a great level of satisfaction, and we want to make sure that that continues and is sustained over the long run.
How has it affected your recruiting as well?
Well, that's a double-edged sword right now, because we are, just as all of healthcare is in so many sectors of the economy, dealing with the great resignation and the workforce shortages that are occurring right now. But I would posit that it has served as an incredible retention initiative for us, for our employees. And we now have increased our ability to recruit incredible talent from farther geographic reaches, because many employees who are now working in these remote environments can work from home, and it doesn't have to be in Missouri or Kansas. It could be in New York or California or Idaho. It can be from a number of different locations that we can recruit talent. So I think it's a bit of a double-edged sword, and the jury is still out, but I think it's assisted in our retention efforts, and it's assisting in kind of focused ways with our recruitment efforts as well.
Tell me a little bit more about the beta testing you're doing and the remote site that you have at Children's Mercy.
Yeah. So we have some leased space at an office location that's just about an eighth of a mile away from our main hospital campus. And what we've done is we've taken a portion of this space and we have configured it into a hybrid physical working environment that is a combination of some private office space and some open office architecture and some collaboration space where employees can come together and ideate and collaborate and work, irrespective of what department they're working in. So what we're doing is we're bringing employees in sort of these manageable critical masses to come as intact teams, spend a week in the working environment, testing different parts of those spaces, talking and sharing feedback, and then giving that feedback back to our facilitators of this testing in a way where we can assess the data and look at the feedback in sort of a scientific analytical way, and then make changes and refinements to these workspaces going forward. And it will also help guide us in terms of how our policies and procedures will evolve going forward, in terms of what we expect from our employees who are working from home, working in the hybrid spaces, or working permanently in our facilities on a daily basis.
Have any of the findings or any of the feedback that you've gotten so far been surprising to you?
One thing I will say that is perhaps not a surprise, but an important learning. One of the things I will acknowledge that I am concerned about for the long term is the impact on culture. When we are a relationship-based industry where people excel by coming together and we have people that will be working from home, how do we ensure that they are engaged and part of this culture that we continue to nurture? Well, one of the things that my chief compliance officer mentioned today, for example, was we do routine huddles on a daily basis where our teams come together in what we call a tiered huddle structure to check in on daily readiness. Do we have our staff in place, our equipment in place, any barriers or obstacles to safety, to service? Well, what we have done, our frontline managers, through the daily huddles, they have told us that it's a wonderful opportunity to make sure that those employees working from home are fully engaged through their virtual participation in the huddles, where those teams are talking and sharing and talking about the day, talking about projects going forward, and they're engaged. And that's wonderful to hear, because that conversation, dialogue, and engagement will help to foster and solidify that culture that we want to make sure we sustain over time.
Paul, thank you so much for your time and for sharing with us about this.
My pleasure. It's been a pleasure to be with you and to talk about this important topic.
Absolutely. Thank you.